Hi, my name is Trevor Scott, and this is my video for World Mental Health Day and National Coming Out Day. World Mental Health Day is Saturday, October 10th, and National Coming Out Day is Sunday, October 11th here in the United States. As a gay man who has generalized anxiety disorder and social anxiety disorder, as well as having had a lot of loved ones in my life that struggled with mental illness, these days are both really important to me, and it's not insignificant, I guess, for me that they come back to back. Makes it kind of a powerful weekend. And I don't normally do this sort of thing, but I wanted to share one thing today, thinking about the two of these days together and how they kind of inform one another for me. As a 46-year-old dude, when I was born in 1969, homosexuality was illegal in every state in the United States. That year, Illinois became the first to decriminalize it. But the very act of two people of the same sex physically expressing their love for each other was a crime everywhere in the United States. Today, 46 years later, we can be legally married in all 50 states, except for a few counties that are being pills and refusing to follow the law of the land. So I've seen some change in my lifetime, and I've been involved in different kinds of activism and efforts at working for change, from shouting and marching in the streets to writing thoughtful essays to doing crazy performance art and public displays and spectacles, teaching, lots of different things. And I think one of the most powerful things that I've seen in affecting change, and that has made these kind of changes in my lifetime, has just been one-to-one connections. It's been, in terms of queer folks, it's been coming out. It's been being visible so that your friends, your family, your loved ones know you. That over the long haul, nothing is more transformative for people and then for society at large as personally knowing someone that is gay or bisexual or queer or however you identify, making the issue personal and real, and realizing that these people are not monsters, are not evil, that they're people that you know and love. That's been the whole strategy all along for coming out, for being visible, for letting people know that you exist so they can't demonize you. I feel that mental illness is really similar. They are both misunderstood. They used to be thought of as one and the same thing. Homosexuality and variant sexuality and gender expression were all thought of as mental illness. Some are still categorized that way. But you can pass. People don't know the minute they see you that you have mental illness or struggle with it. I know some people don't like that term, but I'm trying to keep this video short. So it is Mental Health Day, so I'm going to stick with mental illness. But people don't always know. People are scared of it. There's stigma associated with it. They don't know what it means. It gets disproportionately and stereotypically blamed for violence and antisocial behavior and all kinds of things like that. And people with mental illness get stereotyped and misrepresented as, sad, lonely, suicidal, doomed to a miserable life. Much like LGBTQIA people were stereotyped and still are in media and movies and things like that. But it's coming out and being visible with mental illness is one of the ways that you can destigmatize it, that you can make people realize it's not something scary, it's not something catching, it's something that people live with, it's something that people treat in a variety of ways. It's not a lie or an excuse or a phase or acting out or being rebellious. And personally, I'd like to add also, we're not stupid. We're not all mindless sheeple. We're not all mindless sheeple that have been brainwashed by the pharmaceutical industry. Okay, I'm not going to say that there aren't some questions and some problems and some issues there with overdiagnosis and overprescription, but to tell an entire group of people that they're just stupid for taking medicine that has saved their lives is a really arrogant thing to say. Okay, I'm going to get off that soapbox now. But I just wanted to say, on behalf of all the people that I've known and loved that struggle with mental illness, and including myself, that I think coming out, being visible, talking with it, sharing it in the long run will be as effective a strategy as it was for queer people in destigmatizing it, in getting the support and the social services and the help and the love that you need, helping your loved ones understand you, and generally making the world a better place. So it's a great double dip of visibility and coming out this weekend, right? I'm queer, I'm mentally ill, and life is still pretty damn good. So that's just what I wanted to share on this weekend.